Professor Hirano,
Yes.
we are happy and a pleasure and honor to have you here in Paphos, Cyprus during SIPS 2019. Today is the last day of SIPS 2019 and we wanted from you to have some impression on it.
Yes, I'm really happy to be here too, and I have many great impression about this SIPS conference. It's a huge conference including many areas: chemical, physics, medical, environmental, many things. It's amazing conference. I'm really happy to be
here. What is the difference between SIPS and other conferences, medical conferences you have attended? I guess you attend only medical conferences.
Oh yes. So medical conference is more limited society. Especially my major is ENT, head and neck. So it's more limited area.
So even in the medicine, it is only one part or specialty of medicine conference you attend.
Oh yes, yeah.
Okay. So from a specific head and neck medicines conference, you are attending not only a general medicine conference, but you are attending a conference having numerous fields that even do not relate to medicine. So this is a big difference in.
Oh yes, it's a big difference. But I'm always interested in the other areas conference, and I also prefer to attend anti-aging study or regenerative medicine study. Oh, it's medical, but it's still really interesting for me.
It's medical, but it serves to people which belong to several professions.
So
this is the right way of doing things, and that's why we are planning to do every year an antioxidant symposium.
Oh, that's great for us.
We'll do it every year and we'll continue. We also will do technology in medicine. It is another one idea almost decided for the next year. You were awarded during SIPS 2019 with Geim International Innovation Award.
Oh yes, that's my really honor.
How do you feel about this?
Oh, it's amazing. I was so surprised to get that, and I didn't expect it, and so I really appreciate it.
Yeah, I saw that when you came on stage, you thought I mentioned your name by error.
No problem.
So,
Japanese name is difficult.
No, I spelled it correctly, but you didn't expect it. So, tell me about your stay here. Did you enjoy, and what did you enjoy the most?
Oh, stay here.
Yeah.
Oh, that's great. So our conference is great, and our environment of the Cyprus is great, and food and wine, many collaborators. That's wonderful.
And you attended Oxidative Stress Symposium.
Oh yes, Awardees.
Did you have any chance to visit other symposia?
I had some plenary lectures by Nobel Prize recipients. Yes, that was very instructive, informative.
Okay. And you remember probably from my opening that we have developed some years ago a new sustainability framework.
Oh yes.
Where we have 3 pillars: science and technology, governance and management, and education and civil society. So they serve 3 purposes: development of protecting our environment, developing our economy, and social human beings. Your field belongs to developing and protecting and making efficient humans.
Oh yes,
So that's why you're a part of this, integral part of this concept of sustainability. This is heart of SIPS. So at the same time, you are a scientist and you develop new technologies in order to in your field and in medicine. So how you see your role in the sustainable development and the SIPS, the role of science and technology in order to achieve well-being of humans.
Well, of humans.
Meaning, in order that to be sustainable, people achieve sustainability and they have to be healthy.
Yeah, right.
So this is where you belong.
Yeah.
You make human beings, you make possible that human beings are healthy in order to develop a society.
Yeah, right.
So in this big picture, how you see the role of medicine and science? Because you are a medical doctor, but you are a scientist also.
Yeah, right. So in Japan, we are taught to see the human beings, not only see the diseases. So we have to see the whole human. And in order to do that, we have to know many knowledges about it, and also we have to study the different areas, and especially the elderly, aging is a big problem in all over the world. And healthy elderly should be great. So we have to keep the life healthy, wealthy, even though we get old. So that should be good sustainability.
Yes, it is. Yes, it is. Because it serves a bigger goal. As a medical doctor, you deal with antioxidants. Tell us about something. How antioxidants apply exactly in your headache and neck specialties?
I believe it can work for several parts, but I'm especially interested in the throat, because throat is very fundamentally important organs, because we breathe, we make voice, and we have to swallow. Once we cannot swallow, the people die. So the throat function is very important. Maybe nobody aware of it so well, but once we damage the throat, everything is going very bad. And antioxidant is very nice to keep the throat healthy, because the throat has a lot of stimulants like pollution, particles, smoke. So it has a place, a bunch of free radicals. So antioxidant is very nice to keep the throat. And also in meantime, I also work in cancer patients in the throat.
And antioxidant has been shown.
We are now searching for that with my collaborator. And it's a different story. We use free radical to kill the cancer cells. But in meantime, free radical damage the unhealthy tissues around the cancer. And it's very important to keep the healthy tissues around the cancers to keep the function after treatment of the cancer. In order to do that, we need to keep a balance. The pros and cons, pros and cons of free radicals.
Or balance of oxidative stress.
Oh yes. So we need oxidative stress to kill the cancer but keep the healthy tissues as well.
And are we able at this stage to determine what is the right limit, the right balance?
Oh yes, that's the point. That's the point we're searching for now.
Yeah.
And probably we can, if we can use antioxidants during the treatment of the cancer, we can keep the tissues more well and treat the cancers. So it's a balance.
But antioxidants also those that control oxidative stress.
Yeah.
They are also useful for prevention, correct?
Oh yes, right.
So they can prevent
antioxidant. Yes.
Cancer. They can.
Yeah, right. That's really true.
Have you tried this? Have you tried it with a patient? Have you suggested?
Not so particularly for cancer, but I recommend the patients to take antioxidant to keep their whole body good and or anti-aging purpose.
Okay. Well, it's a fascinating field, and I
Yes.
think it has a huge future.
Yeah.
That's
Yeah,
my
it is.
personal opinion. And having you here, applying a doctor which applies antioxidant to treat, among others, to treat different diseases like cancer in the throat or other parts, and at the same time to suggest to have it as a prevention. It's really good.
Yeah.
And we see the future of this field, and we continue this antioxidant or whatever oxidative stress symposium in the future every year.
Oh,
And you are
appreciate it.
invited to come to Phuket, Thailand in
Yes.
2020 in November.
November.
Yeah. You are welcome, you and your colleagues, and
Oh,
we are
that's-
happy you are here. The world is one.
Yeah.
The profession
World
is
is-
different.
Yes.
The world is one. You just before coming to the interview, you spoke with another doctor, you spoke another accountant, you spoke another lawyer.
Yeah.
So
Oh, that's interesting.